Okay, well, it's already recording, so we'll just kind of start here. We'll go through all of the questions that were submitted. People may pop in as we kind of go throughout, and we will see what happens.
Awesome.
All right. Okay. Well, first and foremost, thanks so much for joining us, Courtney. We are excited to learn from you and, share your wisdom and your knowledge with everybody else, and be able to answer some questions that have been pre-populated from students who have submitted them previous to this event. Just before we get started, I will do our territorial acknowledgement to acknowledge that the University of Waterloo acknowledges that much of our work takes place on the traditional territory of the neutral Anishinaabe and Haudenosaunee peoples. Our main campus is situated on the Haldeman Tract, the land granted to the Six Nations that includes 6 miles on each side of the Grand River. Our active work towards reconciliation takes place across our campus through research, learning, teaching, and community building, and is coordinated with the Office of Indigenous Relations. So I encourage you and everyone else to understand and learn, how the territorial acknowledgement works into your life, depending on where you are working and learning from, whether that's on a co-op term or your family home, or if you're residing in like residence or a student house. So today's we have Courtney Voisin with us, and Courtney and I actually knew each other back in the good old days of university and school and all that fun stuff. So again, thanks so much for joining us. We are excited to learn, I think, about such a popular topic and career area for students who might be thinking about this as a pathway. So I'll pass it over to you, to Courtney, to do a quick introduction. Tell us a little bit about how you ended up where you are before we jump into some formal questions.
Absolutely. Well, thanks for having me, first and foremost. I am a kinesiology graduate from University of Waterloo. I did co-op there as well, so I had a number of different co-op jobs that we can get into and how that all works as well. But from University of Waterloo, afterwards, I applied to physio school at Western, and so I did 2 years there in my master's, and then started working in outpatient orthopedics at a clinic called SOS Physiotherapy, which some of you might have heard of because of the one on campus. And I've been working there for just over 4 years now. And that's
Awesome.
kind of my trajectory anyway.
Yeah, no, that's great. And like I said, I think it's a very common pathway, or a pathway that a lot of students are looking into and hoping for. So I think that's why, we have so many questions here, which is really good. All right. So question number one, can you tell us a little bit about your takeaways from Waterloo and how Waterloo sets you up for success?
I found when I would talk to other students, like once I got to physio school, Waterloo had a really great, like a very like scientific background. Like I found our coursework in kin, especially. I don't know
Mm,
about the health science programs,
yeah.
but especially in kin, you're going through the why do I do the chemistry and the bio and the physics and all this, but it ended up being very useful, I would say, and felt a little bit ahead when I did get to Western the physio, and their anatomy program, relative to what I've heard from other schools, sounds awesome. So, like, I think getting involved in that, the anatomy dissection or the cadaver labs was really great, or like put me ahead because we had to do some of that in physio school as
Mm,
well. So I found Waterloo set me up really nicely for the academic part. And if I don't know if they're still running those athletic therapy classes with some of
yeah.
the like hands-on component, I would highly recommend or like loved that opportunity to start to introduce, if you're interested in like more clinical work, to take part in some of those if you can. I think another big takeaway from Waterloo, it's maybe you have to try a little bit harder to get involved, or like I got involved with the athletics through co-op jobs and played on intramural teams, and that translates really well when you get to physio school, or any post grad type of program where you want to get involved a little bit more heavily.
Yeah, that's awesome. I'm glad that you said that those courses helped out, because I was previously in recruitment before this role. And I think, a lot of students, those courses make them nervous, or, they're not as confident in those areas. So understanding that it can be a benefit to you later down the line, even though it might not be something you want to do right in that time, is awesome to share. So yeah, thanks for sharing that.
Yeah.
Okay, on the flip side of that, was there anything that you didn't learn or that you had to do additional learning on in order for you to be successful?
I think like we got such a little intro with the like athletic therapy courses,
Mm,
but besides that, when you go to physio school, like learning about the actual injuries and how to treat them and exercise, how do you prescribe and do like I think I don't know what the curriculum looks like exactly now, but I felt there was maybe a little bit lacking of that like exercise prescription and treatment and things like that that you definitely get all what you need out of school, but that was a totally new area that in undergrad you don't get to do a lot of, unfortunately.
yeah, no, that's for sure. And I think there's always going to be, holes and stuff like that and areas for improvement. So it's good to know where that is so you can hopefully set yourself up for success. Leanne, before I jump into the next set of questions here, did you have anything that you wanted to ask Courtney?
I was just more curious about like pursuing a master's. Like it's something I've been looking into recently, so I just like wanted your perspective on it. But yeah.
And like for the physio, it's like a I guess a like a professional degree or professional
Mm.
master's, but there is more like a thesis or like research based master's as well. So I know some students or friends like they've went a different route where they'll pursue like a year or two of a master's program afterwards. Because they want to see either increase their grades or their like chance to get into physio school,
Mhm.
or they're not 100% sure that's what they want to do, so they want to pursue some other avenues. So I do think it's if you're not 100% set on physio or you're not able to get in that first round, it's definitely a great option to go into like a more thesis based or research type masters.
Yeah.
Okay.
Yeah, hopefully
Any
that
other,
answered the
yeah,
question.
any other questions on that, Leanne?
Um, Not for now. Like maybe
Okay.
like.
Yeah.
Yeah.
I think also like for a lot of students thinking a master's can be like daunting too, right? So like understanding like there's so much or like there's resources out there to help you. The professors want you to be successful and like really reaching out to get that assistance is so crucial as well.
Yeah, like once you're in, especially the like program like physio or that type of masters, they want you to be successful. They want you to finish. Like the goal is
Hmm.
not to make it so hard so we lose a couple. It's like, no, we want everyone who starts here to graduate, and they'll help you through that if you're struggling at all.
Yeah, for sure. Awesome. So I know you mentioned that you were in co-op in your undergraduate degree. Can you tell us a little bit about the co-op opportunities that you had?
Yeah, I did find in kin again there it seems like there's more opportunities now, but at the time there was very limited, I felt like opportunities in physio or kin. So I was
Hmm.
really lucky for my first co-op to secure a job at a physiotherapy clinic. And I got to work with physio assistants and physios and prescribe exercise. And I think that's where I really like took off with wanting to do physio in my first co-op job there.
Wow.
And then for other physio jobs, it was nice to get some, I didn't work at a clinic every single time. So it was nice to get some different opportunities. I worked with the Waterloo Athletics,
Hmm.
um, which was great because then I ended up staying on there for part time work for the rest of my undergrad. And just you learn different skills, even if it's not related to physio, where it's like, how can I work with a team? How can I communicate? How can I manage stressful situations or run events? Things like that that you learn from, even if the opportunity is not related to exactly what you want to
Right.
do. And then I worked two co-op terms at the WATPD program, the courses that you guys all, I'm assuming, still have to take, doing some like TAing and program development with them, which again, you learn a whole new set of skills. And I really enjoyed that more than I maybe thought um, I would, but that I think has helped me in my like teaching.
Hmm.
I take a lot of physiotherapy students, and I run the like student volunteer program at SOS. So having that background in like TAing a little bit, giving students feedback, program development has helped me now in this role. So any opportunity can be great.
Yeah. That's neat. I actually really like that. That it's like, yeah, you can always spin something to work out how you did.
Yeah.
This is actually just more of a question that I have that you're working with it. Did you know physio was like what you wanted pretty early on?
I would say no. I think a lot of people there's a few people who are like, yes, I'm gung ho from physio right from high school, but I chose kin because I really liked learning. Just that's what I liked learning
Mhm.
about, like muscles, the joints, the body, and then I really thought I'd actually end up maybe more in like research area, but through my coursework at Waterloo, I ended up not liking it. And some of my co-op jobs, I really liked talking to people and working with people. So it was a nice blend of how can I like mesh the things I like learning about and what I like to do on a day-to-day basis. And that career path just seemed to mesh. And I've kind of like had toyed with, well, maybe like medicine, chiro, things, but I from my like co-op opportunities, I just liked the workflow and the day-to-day of physio and their like what they're about more so than some of the other professions, if that makes sense.
Yeah, no, absolutely. So this question actually kind of piggybacks off of that. What would you say to somebody who isn't sure what they want to do after graduation?
I would say go try things. Like I have a lot of students at the clinic right now who are just recent graduates and they didn't apply right after school, but they're thinking about physio, they're thinking about chiro or some of those different professions, and they're just volunteering with us. And it is a it's a couple hour commitment, but then you get to see that profession firsthand. So volunteer at different places or try to, part-time jobs at different places. And so you can get even if it's a 1 day shadow opportunity, just to get a better idea of what that profession looks like or pick somebody's brain. I would highly recommend putting yourself out there and taking that year to maybe tease out what it is what do you really like doing or how do you want to spend your time day to day? Like if you can't be behind a computer, you don't want to do research or something or like reception or something like that.
For sure. No, that makes sense. All right, so flipping a little bit more to specifically the physio side of things, what made you choose to go to Western's Masters to the Physio Clinic in Kitchener?
From that trajectory.
Yeah, I was like, so what made you choose to go to Western's Masters, I guess is the first point, and then to the Physio Clinic in Kitchener is kind of the second piece.
So first I ended up choosing Western. There's only a handful of physio schools around, and you do your placements in different areas. So the Western catchment area or like where the placements are is London, Kitchener, like that general vicinity. And I knew I probably wanted to end up living or working in the Kitchener area where my friends and family are. And so it made sense for me to choose a school where I would have placements in those areas to build connections, get to know the industry. Because I had really thought about going to Toronto, but I knew Toronto wasn't somewhere I wanted to live or be and work. So then I build all my connections and meet clinicians there, but then I have no work opportunities here. So that was a big looking at where that school is or where that area of service is to choose where do I see my career or like my longevity. Because all the schools are great. Like there's no one better school. I did like that Western's program was a little bit smaller. Like again, Toronto's had I think 90 to 100 students, and Western's at the time was 70, so a little bit smaller, a little bit more niche. I liked the idea of that as well.
Yeah.
And then from there to SOS, I really I met with the owner of SOS, and I had done some interviews at other places, and they were very rigid, like, when they read from tell me about a time you're, in a conflict or something. And I just felt like they didn't get to know me. And then when I sat down with the owner of SOS, it was more casual. Tell me about it. Like I really liked how he like approached that interview. And I felt like I got to know what the clinic was about and their mission and goals and how that fit with me. And I think they really strive for like a fun work environment or like growth of their staff too. So I was really intrigued by like, I think I could really grow and work well with these people in this place. And I ended up like, that's why I chose SOS.
Yeah, that's awesome.
Yeah.
So you touched a little bit on this in that last answer, but for Western, where were your placements and how did you find the learning?
Oh, I did. So the program at the time was 5 different clinical placements of 6 weeks each. It now is 4 different clinical placements and they're 7 to 8 weeks, depending which one it is. The way it's organized is that you have to do a placement in each like area. You have to get a number of clinical hours in each area of physiotherapy. So like an outpatient clinic, a hospital, like a rehab or neurological treatment setting.
Gotcha.
So the it's not as much like the Waterloo Co-op where you're like, I'm not sure if I'm going to get a job. You will always get a placement or get placed. The university organizes those for you. You might not get your first choice, but you always are going to get a placement, and they're going to help you meet those requirements. I did a placement at the health science, like the hospital in London, where I worked in the like cardiac surgery recovery unit and the ICU, which was really neat or really different. I never had worked in that setting. I did a clinic, an outpatient like orthopedics clinic in Kitchener and in London for 2 of my placements. And then I worked in London at the like rehab center, which would kind of be like Freeport here, if people know about that, where we worked with like post-stroke rehabilitation for clients. And then my last placement, why can't I? Was at it was a clinic that specialized in like neuro and vestibular. So it was kind of a combination of, neck and back injuries or vestibular concussion, those type of injuries. So 3 different clinics with different focuses, and then kind of a rehab facility and a hospital were my placements.
Nice. It's awesome that you have like that variety. I think that's really
Yeah.
great. Yeah. Vian, did you have any other further questions before I keep plugging along through these ones?
Sure. Which one was your favorite placement? Just curious.
And you know what, the supervisor definitely makes or breaks
Right.
if you get along with them and jive with them. But I honestly think my placement in the ICU or at the hospital was my favorite placement because it was so different than anything I've ever done, and so much learning and so unique, and very like medical. I never saw myself working in a hospital type setting before, but it made me like consider working like into that industry. So yeah, it was my favorite for that reason.
Yeah, that's interesting.
Yeah, that would be so different. Like I can't
Yeah.
even, well, and you would be seeing new people like constantly, right? Like you wouldn't have the same patients come back and say, oh yeah, I'm good or whatever. You would have so much like variety.
Yeah. And it was like, definitely if you were squeamish, I wouldn't recommend something like working in the ICU, but
That's a good
I
point.
thought it was really cool.
Yeah, that's a really good point. All right. Did you find Waterloo gave you a good base to work off of during your physio school?
Yeah. I know we touched on this a little bit at the beginning, but definitely I found the like, even though Waterloo can be tough, that science like background really set you up nicely, and their anatomy program really set you nicely for some of the like content that you have to do moving forward. And even that athletic therapy class, like if I know it involved like some special tests and checking strength of muscles, and like some people had never had any hands-on experience like that before, or people who are involved in the like athletic therapy, like taping the football team and things like that. I don't know that a lot of other people had that opportunity or chance to do something like that before coming to school. So that was nice.
Yeah, that's a really good point. All right. Were you involved in extracurricular activities during your schooling? And if so, how did you manage your time?
I actually worked multiple part-time jobs, and I would like, hit the gym, play intramurals. I joined the like cadaver dissection club,
Oh yeah,
just to like
nice.
and what's important is like getting volunteer hours for physio school, so I was volunteering at a clinic. So I think just organizing your time and like blocking a schedule, like, okay, I have volunteering for 3 hours, so I won't be able to work on that project, so I need to get it done this weekend, or like, so you have to be really good at prioritizing, okay, what's the first thing I need to get done, and then working your schedule around that. It can be kind of a hectic lifestyle, but if you organize it well and try not to procrastinate. We're all a little bit guilty of that. It can work, but it's challenging with the course load of Waterloo, I find.
Yeah, no, that's totally fair. Well, and you want to set yourself up for success too, right? So, yeah. All right. I think this one actually, Van, you might have submitted originally. I'm going to pull it out. What are some challenges you encounter in your profession, especially working with patients who want to improve their health, and how do you overcome them?
This is a tough question. This is the golden question, I feel like. I think One thing that's difficult about my profession working with people is some people have a really high expectation of like, I show up to physio, I want to be fixed or I want to be better immediately. Or like, why isn't it
Right.
getting better after one
Mhm.
session or 1 week? And having those difficult conversations around expectations um, it can be very challenging. And a lot of times there's awesome like clients who are willing to put in the work, but a lot
Mhm.
of people, they come to you, they get advice. I say, do this. Hopefully, what I ask of them is reasonable, like a few exercises, a few stretches, or ways that they can kind of take their own health and lifestyle into their own hands. And a lot of people don't make that change and then are frustrated when they don't see results. So, learning how to even practicing things like motivational interviewing or how to help people create behavior change is one of
Mhm.
the like biggest challenges or things I've like had to work on as a physio more so than like technical skills of helping somebody.
Yeah, I know that's a really good point. There's more than just saying, okay, let's do this movement, let's do this stretch, let's do this exercise. I
Yeah.
think that that's really important to understand. Okay, what is your favorite exercise slash movement and why?
Oh, that's a tough one. Honestly, like I feel like the squat is like it's functional. Everyone should know how to do it. Everyone needs to do it in their daily life, and a lot of people do it bad. Or
Yeah.
like so it's just one of those like basic kind of movement patterns I think everyone should have down at any age group. And I like when I exercise, I don't know, I prefer to train legs or rather
Yeah,
than upper body, which I feel like some of us can relate to.
that's totally fair. Hi, Arnav. I saw you just popped down there. Put him on the spot. Arnav, I just asked one of your questions. I just said what was your favorite movement slash exercise and why. So I snuck that
Oh,
one in there, but I'll leave all the rest up to you. I'll give you a second to get settled, and then I can throw it over to you for some of your other questions too.
yeah, cool. I just got home, so give me like 2 minutes.
Yeah, no problem at all. Okay, another question here is, can you tell me about some career options of your friends that also graduated from kin who aren't in physio?
Yeah. I um I think working as a registered kinesiologist, a lot of people like don't s- see that as an option. Or like I have a friend who works at Toyota and she practices fairly independently. She will assess and provide suggestions, and there's a lot of roles like that in the like auto industry or in like bigger businesses that have a kinesiology or a kinesiologist on staff, and working in like a clinic as a exercise kind of, I guess you'd be a kinesiologist, but they would
Yeah.
kind of manage, like work with a physio or a chiro to manage that exercise piece of the client's care too. I think the other big area I see people going to is like health and safety in like, let's say the hospital. So you are design like helping make changes to that business to make it more ergonomically friendly for work or assessing people's like return to work abilities. So like health and safety and registered kin are probably the biggest areas
Yeah.
I see people go into. And then um, like chiropractic or like naturopath, osteopath, some different like medical career paths that people go into.
Right. Yeah, I think it's nice that there are so many. And I think sometimes it makes it hard that when you graduate, this isn't your only option, because then sometimes it makes it so much easier and more clear for people. But I think that's such a beauty of it, is that you really do have the opportunity to pick and choose what fits you best and really, what allows you to be successful.
Yeah, definitely.
All right, I'll throw one more at you here and then I'll turn it over to Arnav. Can you explain the pieces of applying to physio and what they prioritize?
That's a hard question because I think each school prioritizes different things,
Yeah.
but the general application process, you typically need, they definitely, grades are of a high priority. It's almost like that first screening. If you don't have X amount of grade, you're probably not even getting looked at. And I would say the GPA or I don't know how each school does it, but you'd be looking at like high 80s to 90s as an average. Um, when it was like my year. And it's different each year that
Yeah.
people apply based on what people are applying with, but that's what you would want to strive for. And it's not to say if you don't have that you still can't get in, but you'd want to have a resume of extracurriculars as well. They want to see that you've had some volunteer experience. And I think a lot of people think I'll just volunteer at an orthopedic clinic. Most people do that now. So having something
Yeah.
different where you've worked with elderly population, kids, people with disabilities, they want to see you've worked in like different areas or different industries. So trying to get some volunteer experience that's a little more outside the box or at the hospital or something, in addition to just an outpatient clinic. Then the last piece of the puzzle is your reference letters. You need, I think, one academic and one a clinical, like someone who's a physiotherapist, chiro, something like that. That may have changed, like a third letter, or I don't know exactly what it is right now, but those were the two that we needed at the time. So an academic and a clinical reference. And only Toronto had done the Casper exam when I applied, but now it's my understanding all the schools are using that Casper exam score as well to factor into consideration. And if people don't know what that is, it's a difficult exam to study for. There are like practice questions that you can find online, but it's more looking at how you work through a problem, or the questions are kind of ethical where there's no right or wrong answer, but they want you to argue both sides. Or so it is a difficult exam to prep for, but there are resources online to
Yeah.
help you.
Yeah,
So I
for
think
sure.
those are the main components.
I think one thing I would say too is like if you are thinking some sort of professional school, it's never too early to look at the requirements, right? Like,
No.
and a lot of them, they're like they might not be similar in the sense of exactly what they're looking for, but they're looking for that experience in the area. They're looking for that variety of experience. So it's never too early to kind of try and get some of those volunteer opportunities and stuff in as soon as you can.
Yeah. And if you're like dead set on physio and you do some volunteering and you're like, oh, I kind of hate this, then you're like, maybe I won't
Right.
apply
Yeah.
or take
Yeah.
that as my career path. So it's good to get those experiences and you'll know, have a better idea of like, oh, yeah, this is what I want to be doing.
Right. No, that's a really good point. Arnav, you got any questions for Courtney?
Yep.
Hi.
Well, sorry that took me so long. My dad stopped for gas, which I wasn't expecting. So
No, that's totally fine. We are still here and hanging out. You know what? We're just kind of working through all the other questions. I'm almost through them, so it's perfect timing for you to pop on.
cool. Okay. So the one I was most interested about is like, what do you see most often, like injury wise? I think that it was that, or which age group do you see the most often?
Yeah, and it depends to where you like work or what type of clinic, but at our clinic we kind of see anything from I'll have a high school student all the way up to I have a 92-year-old on my caseload, so you get that variety, but the most common is kind of actually that middle age, like 40 to 60 population, and you're starting to get into a little bit of that like arthritis and things going on. um, Neck pain and low back pain are definitely like the two most common, and then third on the list I would say is shoulder pain as well, or like rotator cuff injury. And a lot of times people come in with injuries that don't have a mechanism, or something didn't happen, it was just something that came on gradually for them, is more common than a sports injury or something. Yeah.
Okay. So would you work like really closely with like ergonomists? I don't know how to pronounce it, but like
Yeah, at our clinic, like we don't have someone who specializes in that, but people at their different workplaces, if they have a health and safety person or a ergonomist, I think, I don't know,
yeah,
or like,
ergonomist. It's something
or
like that.
yeah, I would like write a recommendation or a letter for them, or show them, here's how you should like, you could adjust your workstation or set it up. And a lot of people to work from home now, so I'll have them take a picture of your setup and we can talk about how to arrange it a little bit better for what you have going on. Definitely not an area I like specialize in, but you as a physio have that basic knowledge of, well, here you should be, sitting a bit more like this, or not turning to the side all day, something like that.
Yeah.
Yeah.
Cool. Like the vulnerable, I kind of caught a little bit of like what was it what physiotherapy schools were looking for, like schools with programs were looking for? Is that what it was? Where it's like they're looking for you to work with vulnerable populations, not just like, oh, I'll work here.
Yeah. So
Yeah,
like what were the physio schools looking for? Yeah.
I
Mhm.
think that would say, like, if you wanted your application to stand out, having a variety of, yeah, working with those vulnerable populations like geriatrics, kids, people with disabilities, like that would definitely put you, because everyone's application says, I like sports and I worked with the football team and taped some ankles. And that
Yeah.
they'd say, okay, so how's everyone else? But what makes you different? Or having those experiences, because that's who you're going to be seeing and working with a lot of time too, in that career, so they want to see that you have that ability.
Okay. Interesting. Because I've like worked in a retirement home,
Yeah.
and like how do you so you said you've seen people like a 92-year-old.
Yeah.
How do you feel? Actually, I don't know. How do you feel about working with populations like that? Like it's rewarding, but at the same time, like, are you stressed at any point?
About their well-being, or
Yeah, yeah.
no, because generally the people who are coming to my clinic, it's like an outpatient setting. They walk in by
Okay, yeah.
themselves.
Okay, yeah.
They're doing well usually, or they're like fairly active. And
Yeah.
um we have had, incidences in the clinic where someone has had a medical emergency, and it's not always your like old people. It's um
Yeah.
we had like, someone in their 70s have a heart attack, and so you do have your like your first aid and your training to like manage those situations. But that was like once in 4 years since I've been there that you have that. Your setting might be different if you were at like a hospital type setting or something where you're having people coming in who are quite ill. But generally in our clinic, they kind of came in at their own will, or they came with a daughter, a husband, someone who like can help them out, and they're usually in pretty good shape at that point. If that hopefully answers your question.
That does, yeah. I Okay. Yeah.
I see a difference in the people who are coming in when they're 92, what kind of lifestyle they've had, versus the people who are not doing so well, like in their 60s. You
Mm.
see a lot of discrepancy. And well, the 92-year-old is like, well, my arm hurts, but I gotta hit pickleball 3 times this week and then go walking with my friend. And that, their lifestyle is a little bit different. And you can see how it's gotten them to that point where they're coming because their shoulders a bit sore from pickleball or something.
Yeah. Wow, that's cool. I didn't think about that. You get to like see
You see
people's like
trends
life.
as you work.
Yeah.
Yeah, yeah. Which is good and bad. You're like, let's fix some of these trends if we can. But
Yeah. Have you worked in any other fields?
I when I first I didn't mention this because I thought it was maybe too much to throw in the mix as well. But when I graduated the first 2 years, I worked casually at the hospital. I was a physiotherapist as well there. But it
Mhm.
was, I would work with post-surgical people who had total hip and knee replacements, and then people who just had a stroke. So there were the two units that I worked on, and I just did like Saturdays, holidays coverage for them. But it was a nice way to get a completely different setting or like type of physiotherapy as well. Um, I liked that work quite a lot. I loved the clinic I was at, and it became too much to have two of those jobs on the go. So I ended up
Yeah.
choosing that, but I still very much liked that work as well.
What's your favorite population to work with?
Oh,
Kind of like,
I
yeah.
would say those like older people who are more active, like, the person who's retired and they want to golf 3 times a week, and because I find they have time to do what you ask of them, and
Yeah.
they have things that they want, like someone who has something they want to get back to or has a goal for me. I really like working with, because I can work with that.
Cool. It's about everything. If anything else comes
Yeah,
up.
for sure.
I have one more question. I think you submitted or not. I could be wrong
Oh,
though.
Did I forget?
And this might be, you might say like, oh, I don't do this at my clinic, and that's okay. But what
Yeah.
are your thoughts on acupuncture and dry needling?
Oh,
And if
yeah,
you've
that-
worked with
Ah.
it, what does it work best for?
Yeah.
I do acupuncture and dry needling. I have training in both,
Mhm.
and I use it all the time. It's the acupuncture, or more traditional acupuncture, I find works well when something is more acute, more painful, and it's difficult to do a lot of exercise or hands-on, and it can help settle down the nervous system. So I tend to use that one when things are more fresh or more irritable. I really like using it for headache and concussion clients as well. Um, and then the dry needling is kind of a subset of acupuncture that I explain it to people like a muscle reset. We put that needle in like a tight band or knot of the muscle. It makes your muscle jump or twitch, and then it relaxes afterwards. And so it's a really nice like muscle reset. And that works well if someone has a muscle tension or some muscle guarding around an area that we need to get rid of in order to get that area moving, or they're having pain in that muscle, and then we complement it with an exercise. So yes, that muscle might tighten back up, but if they're doing what they're supposed to be doing at home, it shouldn't or shouldn't come back or need to consistently be dry needled. And I use that in I've used it in high school students. I've used it on my 92-year-old. Like that kind of works well for anyone with muscle tension.
Interesting. I wasn't expecting you to have used it that often. I mean,
Yeah,
yeah.
it's a really efficient way to release a muscle. Like a lot of people will turn to massage or things like
Yeah.
that, but it's just I find it works very quickly to get. It's one of the things I can do in the clinic to see results very fast. Have any of you ever had it before? No.
Never.
Oh wow. It's not the most
Shit.
comfortable of techniques, I would say,
Okay.
but if you get a chance to try it, I would recommend.
Okay.
Yeah.
Okay, when I'm in my 40s and sore everywhere.
Get those needles in me. Oh, that's
Fine.
awesome. Any other questions from our number VN? No. Awesome. Well, that is through our list of questions. So, unless there's anything else, Courtney, that you wanted to add in before we wrap things up.
No, I think we covered. Those are great questions. Those are all good.
Yeah, it's nice to have those pre-submitted ones so students can go back, and watch it and be able to understand, where it's coming from. And those people who weren't able to come can then go back and get a feel for it too. So thanks so
Yeah.
much, Courtney, for taking some time to spend with us here. We really appreciate it. And I think, yeah, the knowledge that the students will get from watching this is so valuable, and excited to hear kind of, their thoughts and what they bring from it. So like I said, as it being such a common field and an area of interest, it's so topical for students to be able to gauge and understand what their future could possibly look like if this is a career that they decide is correct for them. So thanks again for taking
Absolutely.
this time. We really appreciate it. And
No
we'll be
problem.
in touch.
Awesome. Take care, guys. Have a great night.
Thank you. You too.
Thank you.
Bye.